Hello guys, welcome back to my channel Dentistry for Beginners. So guys, today we are going to talk about Ashley-Ho's analysis. So what is Ashley-Ho analysis basically? So this is tooth crowding is due to deficiency in arch width rather than arch length. So basically what Ashley-Ho's tell that the tooth crowding which is present in an arch, that is due to arch width, not due to arch length. So in order to measure this, Ashley-Ho did what? So he measured 4 different things to determine Ashley-Ho analysis. First is determination of total tooth material, TTM, determination of premolar diameter, PMD, determination of premolar basal arch width, PMBAW, and premolar basal arch width percentage, that is PMBAW percentage. So determination of total tooth material, this is what? This is sum of mesiodistal width of first molar to first molar. So in this image we can see that these two tips of divider can be placed, one on mesial side of a tooth and second on distal side of tooth. So here we need to measure from first molar to first molar. So this is first molar of right side and this is first molar of left side. So from here to here there are total 12 teeth. So total width of the 12 teeth anterior to the second molar, that is from first molar to first molar, are calculated. So this is what? So this gives total tooth material dimensions. Now determination of premolar diameter. It is the arch width from tip of buccal cusp of first premolar to buccal cusp tip of opposite premolar. So here what is in this cast we can see this particular point is buccal cusp tip of first premolar on right side and this is buccal cusp tip of first premolar on left side. So from divider, what we will do, we will point to ends of the divider on these two particular points and then we will measure. So that gives us premolar diameter value. Now determination of premolar basal arch width. It is the width from canine fossa of one side to canine fossa of other. So basically what? In basal arch width, it is like basal arch width, the width of the bone. So that is measured in the bone region and that is where canine fossa. So basically canine fossa is found distal to canine eminence. So there is canine eminence present below the canine in maxillary arches. You can feel that there's a ditch. So that is canine fossa. But if the canine fossa is not clearly distinguishable, then the measurement is made from a point 8 mm below the crest of interdental papilla distal to canine. So basically when canine fossa is not distinguishable through canine eminence, then what we do, we measure it from a point that is 8 mm below to what? Crest of interdental papilla distal to canine. So as we can see here, distal to canine, we have drawn a line. On this line, from that interdental papilla region, we will mark a point 8 mm below. And this is how on both the sides we will mark and then we will measure. So this will give us premolar basal arch width. Now inference of Ashley-Ho analysis. Premolar basal arch width is greater than premolar diameter, then arch expansion is possible. Means premolar basal arch width is greater. That means bone area is more, but the premolar diameter, premolars are placed in a less region. That means we can expand it because in bone region we have enough space available. But if premolar basal arch width is less, then what happens? Arch expansion is not possible because teeth are already outside the arch, if we can visualize it. So that means in this case we cannot expand. Now premolar basal arch width percentage. This is ratio between premolar basal arch width and total tooth material. So here premolar basal arch width multiplied by 100 and divided by total tooth material is measured. So now this premolar basal arch width, according to Ashley-Ho, it is 44% of total tooth material. Premolar basal arch width, if it is 37% or less, then there is no need to extract. But if it's 37 to 44%, then that means this is a borderline case. And when it is 44% or more, that means this is a definitely non-extraction case. So now from this example, we will understand this is the maxillary arch of a patient. Here we can see spacing and a broad arch. So here total tooth material is 94 millimeter. Premolar distance is 48 millimeter. Premolar basal arch width is 44 millimeter. So premolar basal arch width, which is 44 millimeter, this is less than premolar distance, that is 48. So in this case, there is no expansion possible. And when we talk about premolar basal arch width percentage, so this is 46.80%. That means this is definitely a non-extraction case. And from this example too, we can see there is crowding present and this arch is seen constricted. So here total tooth material is 102 millimeter. Premolar distance is 36 millimeter. Premolar basal arch width is 38 millimeter. So premolar basal arch width, which is 38 millimeter, is more than premolar diameter, which is 36 millimeter. That means in this case, expansion can be possible. And when we talk about premolar basal arch width percentage, this is 37.26. So it's between 37 and 44%. That means it is a borderline case. Thus, in this case, we will just correlate the findings with other analysis also, and then we will decide we need to expand or extract depending on every other findings. So this is how Ashley-Ho analysis is done. It's very simple and it can be done easily in 5 to 10 minutes. And I hope you are understanding what I'm trying to tell you, teach you. Thank you for listening. Thank you for giving support. And thank you so much, guys. We'll see you in other topic. Thank you.